Hi, my name's Vanessa Hill. I work at East Point and I'm a community relations specialist. Today, what we're going to talk about is the language of recovery. So, when we think about the language we use, think about whether you pick a flower or you pick a weed. Do you treat those two differently? So, words are important. If we want to care for something, we usually call it a flower. If you want to kill something, we usually call it a weed. So, we know from research that has been conducted by some of the world's leading neuroscientists that drug addiction is not a moral failing on the part of the individual. It's a chronic disease of the brain and it can be treated. But we treat people with substance use disorders differently. Think about some of the chronic diseases like hypertension or diabetes or asthma. Would we think that's a moral failing of folks if they got diagnosed with that? Any different? Do we treat them any different with the folks that have substance use disorder? And usually the answer is yes. There's a quote that says, "Recovery is a process of change whereby individuals improve their health and wellness to live a self-directed life and strive to reach their potential." So, what are some principles of recovery? Recovery has to be person driven. That means it's up to them. Their recovery is theirs. Because I deal with a situation a certain way doesn't mean that that's the only way to deal with it. So, there can be many paths to recovery, and there's no wrong way to get there. The important thing is we get there. We have to think about recovery being holistic. It's not just one problem, it's all the problems that we need to look at. Recovery has to be supported by peers through relationships, our social networks. It can be culturally based and influenced. And one of the big things that we have to recognize is what trauma got the person where they are now that they're using substances. Recovery involves individuals and families, community strengths and responsibilities, and we have to know that recovery is based on respect and it emerges from hope. So, the most respectful way of referring to people is to refer to them as people. It's not an addict, it's not an alcoholic, it's a person that has addiction issues or a person that has alcohol issues that it's just a misuse. So, describing a recovery oriented system of care, Dr. Clark said recovery oriented systems of care shift the question from how do we get the person in treatment to how do we support the person in recovery within the person's environment. And that's really important. So, when we think about recovery management, it's a philosophical framework. First of all, we have to know there's a problem. They have to know there's a problem. So there's a pre-recovery identification and engagement. Then we go to recovery initiation and stabilization, and they may go through this process several times. Then there's the long-term recovery maintenance, and then the ultimate goal is the quality of life enhancement for individuals and their family members. We get into trouble when we talk about those people being alcoholics or addicts or junkies. And then there's always the chronic relapser. So we need to be careful in how we refer to the folks. Clients don't hit bottom, they live on the bottom. If we wait for them to hit the bottom, they may die. The obstacle to their engagement in treatment is not the absence of pain, it's the absence of hope. And it's up to us to give them that hope. Alcoholics Anonymous had a quote that said, "When I stopped living in the problem and began living in the answer, the problem went away." So they take a lot of support. We have to be there for them. If you have substance use issues or you know someone that does and that they need help, you can call East Point at 800-913-6109. They answer the phone 24 hours a day, 7 days a week, 365 days a year. There's also information that the library has on how to get help. It's called our access brochure, and they will be glad to give them to you if you need services. Thank you.